case because I have a congenital issue that is known as Epidermolysis bullosa. So this is a continuation to yesterday's, and so this is what I'm going to show you. I'm going to show you how I've been using TCM to cure my foot pain issues and also correlate it to other deficiencies that I feel I was born with. So let's go down this road. So the case study here is that the pathology of Epidermolysis bullosa, the biomedical diagnosis and prognosis and clinical studies, and Chinese traditional Chinese medicine symptomology, diagnosis, treatment, and my post-treatment results. So this is what Epidermolysis bullosa is a congenital autosomal disease that causes skin to be fragile. Because the skin is so fragile, it can easily be injured. It rips off with any slight mechanical friction, creating a bulle, which is filled with fluid or sometimes blood if the capillaries are broken into. To a microscopic look, the epidermis separates from the dermis, and that ripping occurs right here because the upper layer gets pulled off, and the protein that's supposed to anchor the two layers is actually frayed. That's my congenital disorder, that protein isn't correctly made. So what happens is that as that frays, I feel pain, inflammatory responses by the end of the night, the whole week, years, 34 years worth, keratinization, hardening, so scleroderma, and then scarring. I can show you some pictures at the very end of the presentation. So this is what the incidence rate is around the world. Inherited connective tissue disease. It appears in 1 in 5,000 people. So I was looking at Florida statistics last night. 400,000 people live in Miami, so that means you got a total of 8 people that you can probably, I make 9 maybe in Miami now who have this. It is a result of a defect anchoring between the epidermis and the dermis, as I've said, and it could be mild to lethal. So what was interesting as I was talking about this yesterday was that this, and I'll show you, I inherited from my mother, who inherited from her father, and has only been made popular in popular media since 2004 with something called The Boy Whose Skin Fell Off, chronicling the life and death of Johnny Kennedy. And in the that was released in England, and in the United States, My Flesh and Blood by an HBO special, 2003. So the name has now been given to these children who were born this way: butterfly children, cotton wool babies, or crystal skin children. Marguerite, who just graduated or just finished up her program, actually worked with a child in the hospital in Miami, and she told me that just applying tape to his skin to keep the bandages down would just rip more layers of skin off. And I'll show you pictures of that. So there's 3 kinds of congenital disorders that it comes in. So we got 3 flavors. The most common is the simplex. EB simplex causes blisters on hands and feet, which is my experience. The genes, KRT5 and KRT14 and the PLEC gene, are the anchoring genes that are defective in this type. You have junctional, which appears in 1% of those 50,000 incidences. This is more severe, more commonly in the hands and feet, all the areas within the skin. This is a recessive, and this is a dominant, and then you have dystrophic, which most of these children won't live. Their skin just rubs off with friction, contact, a blanket. They're known as butterfly children. So the genetic cause of this, for my case specifically, and when I started getting into the Chinese medicine, doctor, please by all means throw in your 2 cents, because I would love to know what you believe about this. So overall, I see a kidney deficiency occurring. My grandfather passed it on to my mother. My mother gave it to me, but not my brother. So you can see an autosomal dominant recessive pattern there occurring. So once again, this affects all races, and that is an Iranian child born with EB. And you can see around the toes, his hands, he's peeled all his skin off just by scratching, and they're very painful wounds. And you don't really expect normal friction to cause such severe pains, but it does feel like a 3rd-degree burn, even though technically it is a 2nd-degree burn, because it's just the epi and the dermal layer that are ripping. But the pain is intense. So malignancies of cancer to the skin can occur. I'm going to give you the recent research so you have a whole background on what's happening in the West, because this is something new and very applicable to burn victims if you think about it in that way. So what recent research is focusing on is changing the mixture of the keratins in the skin to produce a balanced reaction in which the cells choose not to use the mutated version and use the newer intact keratin gene. Some studies have shown that vegetable extracts from broccoli can reduce blistering. Human trials, this is how serious this can be. There are two brothers who were born who received a bone transfusion. So bone transfusion is one of the answers to this condition if you're immediately diagnosed and then born with it. But severe immunosuppression is one of those things that is a complication of bone marrow transplant, and at least 4 patients have died in the course of this preparation just to do this. So it's not something that's very easy to cure. You here in A, you have a picture of someone's flank just by wearing jeans, walking, exiting, entering a car, has produced multiple lesions and bruises, blisters, and then of course the healing afterwards. What C is showing you is that they've created genetically modified skin, though it lacks hair, sebaceous cells, and other cells that I'm not accounting for. It does cosmetically cover up the burn. And so once again, this research is going towards burn victims to give them a better appearance. D shows you how the protein, which is fluorescing here in green, that is the protein that just, like rope, that is frayed, will rip right off. So last, we're getting there. Some of the things that I have experienced is because my condition really manifests mostly in my feet. Things related to that are going to be constant scarring. So things like calluses, bunions, warts, not warts, corns, ingrown toenails, neuroma, nerve damage or nerve pain constantly firing off. From walking in odd positions to avoid the pain, I've obviously created tendinitis. Stepping on certain parts of my bone absolutely hurt, especially if there's ulcers or sores there. And of course, if I was overweight, if I was pregnant, or had a previous foot injury, this would complicate my life even more. So it's not something that people necessarily want to add on to their life. So now I'm going into the traditional Chinese medicine. And so I'm male, 34, born with EB, which is obviously a laminin collagen protein deficiency. So we see some kidney. The patient did suffer from single or multiple blister formations on the feet throughout my life. Hands after many hours, repeated motions like walking, running, grasping, swinging. The blisters would require lancing and draining to relieve the pain, obviously. If not, I would not be able to step on that part. And sometimes it would immobilize me for days. Years of continual damage by friction has formed blisters and the hardening of skin known as scleroderma. More with the case history, the patient has had careers that require many hours of standing, speaking, walking, studying, dealing with stressful situations, and making decisions. I was a high school teacher in a special education school in New York, thus making it difficult for him to find relief. In the last 5 years, he noticed atrophy of the muscles around his left and right ankles and calves, a cause of unsteady balance on his feet, and an increase in painful, dull sensations around the scarred toes and tissue, especially when I felt a sense of stress around me. The entire big toe, 2nd, 4th, and 5th, also exhibit deep pain most of the time whenever I'm stepping, and they have signs of hardened and keratinized skin. So bathing relieves the muscle tension and the pain, and I do feel it mostly in my lower extremities. So just to give you a quick recap, this was a survey of what most people feel on a daily in terms of foot pain in the heel. I feel it mostly in the sole because placing my foot, my toes rubbing will cause the blisters to form there, mostly here in the middle and here. So what I've seen are, well, these are the symptoms. Intense pain. So that causes me to have a different kind of gait. But now, I'm going to talk about something else in terms of traditional Chinese medicine, because the West diagnosed just the foot pain, but where's the correlation to my systemic dysfunction? The patient has always noticed a sense of sensitivity to certain foods, heavy in oils like fried fast food and red meats, as these foods tend to bloat him up, cause indigestion and mild nausea. The patient's personal experience has made me become more vegetarian, Mediterranean in my diet, and sometimes piscatorial if there's no mercury in my food. The tongue It usually manifests as pale, sticky white, sometimes at yellow, because I have seen exhibits of, I've seen heat in my system, but I'm going to focus in on now where I'm at, which is better than I was a year ago. There's a white yellow coat, sorry. It's wet, swollen, and red around the tip, and my pulse is usually slippery and wiry. I know that pain manifests as a wiry pulse. So here are some things that has really made a difference in my life by changing my diet. This is a healthier food pyramid. I've included a lot more grains, which in 5-element theory corresponds to supporting the earth. Obviously, beans are an issue with nitrogen. Pasta's processed, so I don't do too many of that. Superfruits are better than the cheesy sweet ones, which is going to cause dampness. And vegetables, especially carrots, have been helping me tonify my stomach. Seafood obviously can be a little sketchy depending on where you're getting from. Asian mushrooms, I have a special place for these. I'll get to that. Sources of protein, I do find my sources of protein in my grains, but I've given these up because there's a lot of cholesterol and phlegm, so obviously I don't want to irritate the belly. Lots of herbs and spices are really under-recognized in our cooking. Like turmeric is amazing for the intestines. The oldest living people on planet Earth actually live off of an island in Japan. They drink turmeric tea every day, and they have the lowest incidence of tumor cancers, carcinomas. Tea, obviously, my supplements is one of the key things I'll get to, and God, I love chocolate. Being Colombian and Uruguayan, I have to honor that. So here are my things that I've felt have manifested throughout my life that are connected to EB, which Western doctors would not have an idea. They might call it IBS, which was a really good presentation, by the way. Indigestion, soft watery stools. There's a Bristol stool chart you can look up. I sometimes range from 5, 6, and 7. I thought I'd put it out there and make it really upfront for you so you could see it and visualize your patients too. Berbergemia, my stomach always making noise. I distend when I eat sometimes, and I get sometimes attack of stabbing belly aches, which some people in this room have seen me exhibit. I have malaise and weakness in my limbs. I do exercise a lot, but sometimes it's a fight for me to get the bones moving. I actually wear contacts, so I have poor blurred vision. So we'll see where this connection comes in with liver. And if you don't really know me, you think I might be a sweet guy, but I actually have incidents of explosive anger, and sometimes I wonder where that comes from. So let's see what my diagnosis is says. I feel I've done this for myself, combined with other, I confuse people in the clinic, so I understand, because this is a long-term standing illness. Spleen sheet deficiency with dampened phlegm, plus an underlying kidney yang deficiency is how I view my symptomology. So I was recommended bi-weekly treatments of acupuncture. So let's see how I got to this. I've been studying some books from the library. I highly recommend it. It's very helpful. Phlegm is the source of 100 diseases. So if we look at 5-element theory, I have a congenital disorder. Perhaps when I was born, my kidneys weren't up to snuff, as I would like to appreciate that. A deficiency in my kidneys, because it was a congenital inheritance, may have, one, affected the liver, because it is the mother of the liver, may have insulted my spleen, because it is the grandchild of, and maybe there's throughout my life a continual back and forth of it. So why do I say liver? I'll show you, and also of course if liver is dysfunctional, it might be overacting on the spleen. I was actually born with jaundice and developed it 3 days after. And I have poor vision, which started to decline very early on, around 10, 12. Obviously I was born with EB. And the issues I've said before regarding my digestion and my malaise, and obviously the blisters, which is skin on my limbs, which is the forte of the spleen. So what I see here is an involvement of 3 major organs in Chinese medicine, starting with something I inherited, starting with something that manifested when I was born, and something that keeps on going throughout my life. So this is how I understand it. What are some of the acu-treatments that have been done in clinic for me and why? So we have liver 3, which is a shoestring point, and it's tonifying earth. Sometimes you'll see red around my eyes. I attribute that to phlegm in my gallbladder channel. Pain in the hypochondriac region, it spreads liver qi, and it starts damp heat lower banner. I don't want to go through all of these, but I'll tell you some of the key ones. Bafeng was great to reduce the heat when I was probably consuming too many products, not drinking enough water, which I see here in Florida as a necessity, and I learned that the hard way. Spleen 9 helps with damp to dispel wind, cold. We have spleen 6, which helps with my distension and the dampness, to transform the dampness. Spleen 4, once again, distension and regulates the Chong Mai. And spleen 2 for gastric pain and abdominal distension. Ren 6 and Ren 12 for my abdominal pain to regulate the qi, dispel dampness and turbidity. Ren 12 for fortifying the spleen and transforming that damp and harmonizing my stomach. And stomach 21 for gastric pain, transform those accumulations. Stomach 28 to regulate the qi in the abdomen. 38 to relax my muscles and tendons, which are always stressed. Feng Long, which transform phlegm and dampness, really important in my treatment. And stomach 42 for muscular atrophy and impairment of the foot, supports spleen qi and transforms the damp. Some things that, like I said, I'm a confusing case, so sometimes I don't necessarily know which medications prescribed to me help. This has been the most recent one, 6th Gentleman, Li Junzitang. It has been very helpful for me. Some key ingredients that, notice that I have also personally studied myself, so I know what supplements I need to add to myself. But what I notice is that there's ingredients in here that I particularly found on my own research that are very helpful. So Ren Shen is great for tonifying the spleen and relieving the fatigue. Baiju tonifies qi and strengthens the spleen. The stomach also dries that dampness. Fu Ling, which I take another form of, you will see it's a polyporia mushroom. It strengthens the spleen and drains that dampness. Zigan Cao warms my middle jiao. Chen Pi reduce my phlegm, and obviously Ji Ban Jiao. I cannot say it. I won't try. Break up qi stagnation. So, gastritis, peptic ulcer, IBS, or Crohn's disease is what I would have been diagnosed if I went to the Western doctor with this. This is what I personally just dealt with on my own, and I've had my mother and my grandfather for advice on that. My personal supplementation has been Ganoderma.